Paige Williams, and today I'll be doing my health promotion presentation on kidney transplants as a result of end-stage renal disease. So, a kidney transplant is a life-sustaining measure when a donor kidney is transplanted into the recipient's body when the patient is in end-stage renal disease, also known as stage 5 renal disease. A transplant is performed so waste products can be filtered from the patient's blood and removed through the body as urine properly again. Some etiology of end-stage renal disease. The two common causes are uncontrolled diabetes mellitus and uncontrolled hypertension. Some other causes are glomerulonephritis, polycystic kidney disease, and recurrent kidney infection, all of which cause damage to the kidney and make it harder for it to filter waste products. For the transplant itself, the donor can be either a living or deceased donor. Living donors are usually family members of the recipient, and when they decide to donate their kidney to their loved one, there's a lot of testing that has to occur in order for the match to be a perfect match to decrease the likelihood of rejection. This includes blood typing, tissue typing, cross-matching, and serology. I've included a picture of an actual kidney transplant. When they do this kidney transplant, they leave the damaged kidneys in the patient's body. However, they just attach the new transplanted kidney in, and it remains there to filter out the waste products. Some clinical manifestations of end-stage renal disease are dry or itchy skin, which can be caused by phosphorus buildup in the body, swelling, which can be a result of salt buildup in the body. Since the patient's kidneys aren't filtering that out, it causes them to retain a lot more fluid. Fatigue or drowsiness, which can be related to anemia because the patient's kidneys are not creating the erythropoietin, which stimulates red blood cell production. And as we know, fatigue is a side effect of anemia. Decrease in urination or inability to urinate. Nausea and vomiting, which is caused by uremia or a buildup of waste in the patient's blood. And weight loss, which occurs due to the nausea and vomiting and the patient not having a good appetite. So for staging of kidney disease, we're going to be talking about GFR, which is the amount of blood that the patient's kidneys are filtering per minute. So kidney damage stage 1 is a normal GFR, which is greater than 90 milliliters per minute. However, they still have some kidney damage. For stage 2, the GFR is a mild reduction, and it's 60 to 89 milliliters per minute. Stage 3A is a moderate reduction in GFR of 45 to 59 milliliters per minute. 3B is also a moderate reduction in GFR from 30 to 44 milliliters per minute. Stage 4 is a severe reduction in GFR from 15 to 29 milliliters per minute. And then we get into stage 5, which is also known as end-stage renal disease, where it's renal failure because the GFR is less than 15 milliliters per minute. Whenever a patient gets to this point, they're eligible for either dialysis or a kidney transplant, which dialysis is where the patient is hooked up to a machine that filters their blood and returns it back into the body as clean, filtered blood. So I'm going to do a demonstration of a healthy kidney versus end-stage renal disease kidney, and it just shows how well they filter out blood. So first we'll start off with, this has some waste products in it. It's sand and rocks and blood, just to show. So we'll put that through the healthy kidney. And then while that's filtering, we'll do the end-stage renal disease kidney. Okay, so as you can see, this is the healthy kidney. There's no waste products in the bottom, and it's retained all of that at the top. That's the waste products from the blood that the kidneys have filtered out, which will exit the body as urine. And then we have the end-stage renal disease kidney, which, as you can see, there's still a lot of waste products down in there, some rocks. So that's going back into the patient's blood, and we don't want that. So that's why they either need a transplant or put on dialysis. So some pathophysiology of the disease depends on the cause of the patient's renal failure, but ultimately end-stage renal disease occurs when the nephrons are not able to filter waste from the blood. This causes the kidneys to overuse nephrons that are not as damaged, which of course over time they end up getting damaged because they're being overused, which causes worsening kidney disease. This is why it's very important to treat the disease properly whenever it's been first noticed so that it doesn't get worse over time. Diagnostics and testing of the disease: you can do lab tests, including a complete blood count to check for anemia, because like I said, the kidneys are not releasing the erythropoietin for blood cell production. A complete metabolic panel, which is going to give you a lot of information about the kidneys, because albumin, calcium, and total protein, the levels will be low with kidney disease, and the BUN and creatinine and phosphate levels will be increased in kidney disease. So that one will give you a lot of information. Also, we would be checking the parathyroid hormone, because when the kidneys are failing, vitamin D decreases, and this causes calcium and phosphorus to be imbalanced in the body. So the phosphorus levels increase, and this causes the parathyroid gland to enlarge and release this parathyroid hormone, which causes the bloods to release calcium in the bloodstream to try to counteract that imbalance. This can lead to bone loss, also causing osteoporosis. We also would want to be checking the patient's A1C, because as I stated earlier, uncontrolled diabetes mellitus is a big cause of kidney disease and kidney damage. So we would want to be ensuring that we check the A1C every 3 months to make sure that patient's diabetes mellitus is well controlled to prevent further kidney damage. We would also be doing urine tests, such as a microscopic examination to inspect for red blood cells and red blood cell casts, because these indicate bleeding from higher, like in the kidneys. So that could be indicating kidney damage. We would be doing also a urinalysis to check for protein and albumin and creatinine in the urine, because if the kidneys are filtering properly, this should not be excreted into the urine, so they should not be in there. We could also do some imaging, which would include CT, MRI, ultrasounds to assess kidney structure and size to see if they're enlarged, and a kidney biopsy, which will tell us which stage of kidney disease the patient's in and how much damage has been done, or if treatment is working to prevent further worsening of the kidneys. Some complications of the disease, of kidney disease, are peripheral vascular disease, hypertension, mineral and bone disorders, because like I said, the body is pulling calcium from the bones, anemia, because the kidneys aren't producing the erythropoietin for the red blood cell production, metabolic acidosis, and coronary heart disease. Also, a complication of a transplant, if the patient does end up getting the kidney transplant, is rejection. So some signs and symptoms of rejection are high blood pressure, oliguria, fever of 101 or higher, body aches or chills, fatigue, and swelling, all because this kidney isn't working properly. And they kind of mimic the signs and symptoms of the kidney disease, so that's something to be on the lookout for if you've had a kidney transplant. Also, for prevention of rejection of the transplant, the patient will be put on immunosuppressants so that their body doesn't attack the new kidney since it's from somebody else, and frequent follow-up appointments. And rationalizing the NLN competency for outcome 1, human flourishing. When caring for a patient with end-stage renal disease or post-kidney transplant, it's important to advocate for the patient so they don't get discouraged. Ensure that they have proper knowledge about their disease and treatment options. And a way you could do this is to provide the patient and their family with learning resources about their condition. Outcome 2, nursing judgment. It's important to stay up to date with current treatment options and community resources to promote quality care, comfort, and health in patients with end-stage renal disease. You could also refer them to a support group for end-stage renal disease. For outcome 3, professional identity, ensure you're practicing only within the scope of your practice while providing care to patients who have end-stage renal disease or are post-kidney transplant to ensure safe and quality care for the patient. For outcome 4, spirit of inquiry suggests new methods to promote and enhance well-being for the patient with end-stage renal disease, possibly referring them for a second opinion for new insight of treatment and care for the patient and their families. And here is a summary of my references. Thank you.